So when it comes to 360 liposuction, 2 positions or 3 positions?
For me, it's 3 positions all the way. I think that's just the best way to get that optimal result, and I can elaborate on that. So obviously, everyone knows 360 liposuction has to do with basically liposuctioning the patient's torso all the way around. So the entire back, the entire front, and all the sides, specifically the waist. And that's really the big focus, is just getting that waist as narrow as possible. There's ways to do it in 2 positions, technically speaking. This is to say, after the patient is asleep on the operating table, she can be put on her stomach and then on her back. And that way the surgeon can access the entire front and the entire back. And that's one perfectly acceptable way of doing it. However, in my experience, I find that I get much better results if I actually go to 3 positions, which means that the patient is on her right side first, then on her left side, and then on her back. And obviously, that takes a little bit more time. That takes a little bit more effort. But I think those 3 positions do allow me to get just a little bit better access to that waist area. And rather than just liposuctioning that area, I can actually sculpt it, which I think makes all the difference in the world as far as the final results. Why do I do it that way? That's how the masters do it. There are some doctors that are very famous for this. Dr. Mendieta, Dr. Gavami, you may have heard of these. Dr. William Rahal, which I would also classify as one of the masters in this. He does more of this than anything else. Those words literally came from him. I asked him when I was working with him back in Beverly Hills a couple years ago, why do you do it in 3 positions? And his answer to me was exactly what I just said. That's how the masters do it. It's a little bit of extra effort and time, but it's worth it.
And so getting that cinched look, I guess if the patient was on her back or on her tummy, is it just a question of access? Like it's hard to reach around and get the perfect shape?
Exactly. That's one way to think about it. It's if the patient's on her front or on her back, if we're focusing on the sides are just not in the perfect position to access. They can be reached with a cannula for sure, but they can't be sculpted, in my opinion, in my hands at least. I think if the patient's actually on her side and maybe even what we call a jackknife on the table, which basically means that we actually kind of bend the entire table to expose that side even more into view, then we can really focus on that area and can feel, exactly how the skin redrapes and exactly what fat there is underneath. That extra position on one side really allows me to sculpt that side of the waist. And then we flip the patient to the other side and do the same thing. And then we address the entire back through that as well. After that is done, then we flip the patient to her back so that we can access and sculpt the entire front.
So she never has to be on her stomach.
Correct. In this particular approach, I think we have very good access to the back as well, just because of that. The way that if she's positioned on the side, that gives us access to the half of her back that is necessary to focus on each side position.